Dr. Paul, I remember your press conference a few days ago where you seem to have been making a very emotional appeal to members of your own fraternity, to the medical warriors, that don't waste this vaccine. You know, there are people who are going without a vaccine, don't waste it. Can I know the reason why you have had to make this emotional appeal? What's your understanding?
Well, Sanket, the appeal comes from the fact that India and Indians, we are fortunate and we are proud that we have the option of going into a massive vaccination program which will escalate exponentially in days to come, and using the vaccines that are developed in our own nation. They are made in India vaccines, they are affordable vaccines, they are great vaccines, and they are available. And we are starting with, just as the rest of the world has done, with the healthcare workers for good reasons. And when the vaccine is being assigned to an individual, one of our health worker colleagues, this vaccine should be accepted. This vaccine is meant to protect him or her, and also to make sure that that person as an individual is then is not in future in the path of transmission of infection. I want to emphasize that when you take vaccine under the current circumstances, you are fulfilling two purposes. Number one, you are protecting yourself, your immediate family, and you are more prepared and more ready and more confident to perform your duties that we have sworn in for. The second, which is equally important, is that when you get vaccinated, when I get vaccinated, the virus cannot spread through me. I'm suppressing the chain of transmission, and that's a societal cause. So I wanted to appeal, and I want to appeal today to all the medical fraternity, healthcare fraternity at large, that please, we are fortunate, receive this vaccine, become fully functional in our discharge of our responsibilities. These are not only COVID responsibilities, but also non-COVID responsibilities, which have been put on a back burner in a significant way. And let's get going, and you help in your own way in suppressing the transmission chain, and therefore this should be embraced. This should be embraced with gratitude to the efforts of people who have brought these great vaccines, made them available to us.
Sure. Dr. Guleria, do you think that the only way to win this, to convince members of the medical fraternity? I remember we were in conversation last Saturday and I asked you this question on doctors not accepting Covaxin. I think the concern and fear is data, efficacy data. Now that Lancet has peer-reviewed the phase 1 trials of Covaxin, now that we see that there are only 1,116 adverse events out of 12.7 lakh people who have been vaccinated, which basically means that the total adverse events are only 0.087%. Do you think the more you take this data to people, the more convincing your argument will be? Otherwise, it will be just appeals and words.
I think so. I think we have to really fight the infodemic against the vaccine with data. And there is robust scientific data, both from what has been published in the Lancet today, and also from whatever has been looked at by the regulators, and what we have as far as even the AstraZeneca vaccine Covishield is concerned. I think it's important not only to look at the data, but to put it forward to make people understand that why it is important for them to be vaccinated. As Dr. Paul mentioned, it is important for us to be able to not only protect ourselves, but people whom we look after. So for healthcare workers, it's also to protect your patients. It's a moral responsibility. For influenza vaccine, it is actually mandatory that if you're working in a hospital, especially in a critical care center or in a transplant unit, you must get yourself vaccinated, because we know that this virus can have mild symptoms and you may actually transmit it to a patient of yours who may be COVID negative and may become COVID positive because of your not being careful. So that is also an important thing that we need to put forward. Secondly, I think it's important for us to understand that we have this window of opportunity right now, which many countries don't have, where our cases are down, our case fatality is down, and therefore if we are able to quickly vaccinate people, we will be able to increase the degree of mass of people who have immunity and thereby prevent any spike which may happen. We've seen this in Brazil, and in Brazil there was a huge number of cases and it came down, and now there's a huge spike which is happening again, which is fox people. And the theory that they put forward as far as Brazil is concerned, that either there is now a very highly infectious strain, or those people who had got infected 6-7 months ago have now had their immunity has come down, and they are now getting reinfection, and that's possible why there's been a resurgence of cases. So this is something we need to be conscious of, because we had a spike somewhere in July, August. We don't want that these patients, some of these individuals whose immunity has come down should now have a chance of getting the infection again. So we have to be able to push forward to get a large number of people vaccinated, both the healthcare and then subsequently the frontline and the high risk group, because this in my mind is a unique opportunity that we have. If we miss the boat and we suddenly have a situation as is happening in UK, in Europe, in Brazil, in South Africa, or in the US, we will actually have lost this opportunity, and then there would be no point regretting the fact that we were not able to really roll out this vaccine when we could to a large number of people, and thereby save lives, keep our economy back on track, and really come out of this pandemic. So that is why I think it's important for us to take the data forward, but also combine that with the reason why there's an urgency to get vaccinated. A lot of people say that, okay, I have faith in the vaccine. I know it's efficacious. I know it's safe, but let others get it first, and I want to see for 2-3 months, and then I'll decide. My appeal is that we may not have 2-3 months. We may have a situation where things may become bad in February, March. Therefore, I personally feel that we should aggressively make people understand that this window of opportunity should not be lost. We should all come forward and use the doses that we have so that everyone can be vaccinated, and we have a good number of people who have some degree of immunity against this virus. This is a clever virus. It can cause asymptomatic disease and will spread among people without even them knowing about it. Let's respect the virus and therefore work aggressively to take control of it.